The need here is great. There is no other place like this Mission of Hope Clinic. There is no other place where poor people can go and get free care, free medicine, free laboratory, free surgeries. We have patients coming from all over Bolivia now that the word is out about Mission of Hope. Our walk-in clinic runs year-round. We have free care for pediatrics, gynecology, and general medicine. We have our own pharmacy to provide free medicine for all of our patients. We also have our own lab, and all the lab work is also free. We're working with a staff of 26 local Bolivian doctors, nurses, administrators, and we have seen to date more than 200,000 patients completely free of charge. The majority of our patients here at the clinic, more than half, are single moms whose husbands have left them. They're left with young children to raise, and when they have a health issue, it's very difficult for them. And sometimes by the time they seek help, their health problem is very far advanced because they've waited and waited and waited because they used all the money they had to take care of their children. Since 2003, we've been bringing surgery teams twice a year from the United States. They take a week off from their work, they pay their own way, and they come here for a week of free surgeries. They arrive in Santa Cruz, they work together for the first time as a team. They also work in with our Bolivian staff. It's a very smooth operation. You would never imagine that they were working together for the first time. We are running 2 operating rooms, 12 hours a day, and we are going to complete 64 surgeries in 5 days' time. A lot of our patients live with dirt floors, no running water. The bathroom is usually a hole in the ground outside with a tarp or some little structure around it. They come here. Some of them are using a flush toilet for the first time. Some of them are getting a hot shower for the first time in their lives. Some of them are sleeping on a real bed for the first time in their lives. Just this week, we heard one patient say that she's had more to eat here in one day than she had eaten in a whole week at home. The praise and worship time every morning is really the highlight of the day. You see these patients who have been in pain and walking around, holding their incisions. All of a sudden, it's like they forget about their surgeries. They're praising the Lord. They're smiling. A lot of decisions made for Christ during that praise and worship time. When we screen the patients for surgery, that is probably the most difficult job we have. We'll screen as many as 200 patients, and there are 64 slots. Many of these people have been with their problems for years. They live with their pain because they have no money. They have no options. Just we see God's hand over this entire week of surgery, getting us through customs with all of our surgery supplies. We have never had anything taken. That is just the Lord. His grace has just been upon every team that's come. I never had any idea that I'd be doing what I'm doing. I never had any plans to be a missionary, to come to Bolivia, to adopt children. None of that was ever in my plans for my life. I was home. It was the middle of the night. I was sound asleep, and all of a sudden I was wide awake, and I was very aware of the Lord's presence. It's hard to describe it. I didn't see anything visibly. I didn't hear anything audibly, but I was just very aware that He was about to speak to me. I saw the face of that mother whose baby had been allergic to the milk, and the Lord revealed to me in a moment that the reason that mother had no milk was because she had had nothing to eat or drink for days. If she would have had any money at all, she would have gone and bought the milk for her baby. As all this was just revealed to me in a moment, I just was overcome with sadness. Tears were rolling down my face, and I just said, not out loud, but Lord, what do you want me to do? And the Lord said to me very clearly, I want you to go to Bolivia. I want you to open a Christian hospital where people can receive free care, free medicines, get good nourishing food to eat, and hear the word of the Lord. 4 things. And I remember thinking, Lord, I don't have any idea how to do that. And the Lord said to me, trust me, I'm going to do it, not you. That was the end of the conversation, and I went back to sleep. When God gave me the vision for Mission of Hope Bolivia, I had no idea of how big this would become. It started out to be just a small clinic in Santa Cruz, seeing patients as they walked in. And now we've just expanded so much because the need is so great. And as our support has expanded, we've been able to expand our services. In the beginning, we were so limited with our funds that we were not able to do very much. Now, as our base of support has increased, we've been able to increase our services. We've been able to hire extra doctors and see many more patients. We don't know what the future holds. We don't know where God will take Mission of Hope Bolivia, but we're open to where He wants to lead. We're open to whatever He wants to do here. This is God's work. This is God's mission. And as He expands the mission, we want to just follow where He leads.